Metagenics has introduced a breakthrough nutritional product solution that helps address the way that the body transitions from an acute immune response into resolution. It's interesting because this is very different from the way that we have been addressing this challenge to date. Here with me today, we have Dr. Bridget Briggs. She's a board-certified MD and a family practitioner in Murrieta, California. Dr. Briggs received her doctorate from the University of California, San Diego, and specializes in functional medicine. She's passionate about integrative lipidology, epigenetics, detoxification enhancement, and gut restoration. Dr. Jennifer Stagg, who is Bastyr University MD with a Memorial University, Newfoundland, Canada, Bachelor's of Science in Biochemistry and Nutrition. A well-known expert in integrative medicine, has appeared on NBC, ABC, CBS, and is a frequent speaker in the Optimal Health and Wellness. Dr. Corey Rice, a DO who is board certified in internal medicine with his undergraduate degree from Baylor University and his medical degree from the Arizona College of Osteopathic Medicine in Glendale. He then went on to complete his internal medicine residency at Methodist Medical Center of Dallas, Texas, where he was elected chief resident during his final year. His practice is a blend of both functional and lifestyle medicine. Dr. John Trope, Chief Science Officer from Metagenics. John holds his PhD from Marquette University in Human Metabolism and Bioenergetics, and he has been the CSO at Metagenics for 4 years. John has led global R&D programs and nutrition healthcare companies including Pfizer, Nestle, Danone, and Novartis. In these roles, he has provided leadership in the delivery of clinical nutrition and medical development programs supporting healthcare outcomes for practitioners and patients. Each of us has had an opportunity to learn and translate this new nutritional approach into our practices. We're also participating in a prospective open-label study using SPM Active. Until now, we have been trained to block this antagonist response to cell and tissue insult that can occur during an overexercising or other situations. But new science and breakthrough research has taught us a vastly different approach to patient care. We have learned from Dr. Serhan at Harvard that there is a very active process that takes place in the body. The body responds to conflict in two distinct ways. First, through the initiation phase, and second, through the resolution phase. In this second phase, that's what we're here to discuss today. While we have always known that to treat the first process, which is the activity that starts in a healthy immune response, we are now learning that the second and most critical phase of resolving activities, clearing debris, remodeling tissue, and returning the body to a homeostatic state. This amazing discovery has led us to the completion and the recovery stage that needs to happen fully to return affected cells back to better functional immune balance. A product that supports and supplements the body's natural ability to aid in the completion of all phases to the immune response. We are here to discuss the protocols in practice that will help our patients bring this natural acute process to a normal conclusion. We want to hear about the unique solution that help patients resolve underlying factors that are present in their wellness campaign. SPM Active is a formula that has been researched and proven to add active pro-resolving mediators to the system in order to support completion of the natural processes that, if left unresolved, may lead to an imbalanced immune activity and increased oxidative stress in our patients. The science has been well researched, and the lipid mediators, isolated and standardized in a patent level of activity, ensure that the OmegaGenics formula replicates the research that Dr. Serhan has been performing for over 15 years. The formula is based on omega-3 science, but the uniqueness runs further in a class of unique lipid mediators that have been isolated, fractionated out of EPA and DHA. These fractions, called specialized pro-resolving mediators, also known as SPMs, are naturally produced in cell tissue and help promote cell tissue repair, remodeling, and returning to normal immune surveillance. And now, for the first time ever, they're made available in a supplement that can be safely consumed to help assist with the body's natural acute immune response. I want to ask my colleagues a few questions to start off the discussion and allow each to contribute with how they selected their ideal candidates for these studies. So Jennifer, what is intriguing to you about SPM Active and the science behind it?
Well, Fab, you know, as a naturopathic physician, my approach to patient care has always been trying to understand the underlying cause of why our patients are dealing with the health challenges that they have. And so Metagenics over the years has been so fabulous at offering solutions for most of our patients, but there are this subset of patients that have difficulty, continued difficulty with their health problems, with the underlying immune response. And so with the science, the new emerging science that we heard from Dr. Serhan, I'm just so confident and excited about the opportunity and for solutions for our patients' problem.
Bridget.
Fab, I can tell you this type of science that Serhan spoke about today is really novel to me. I've never heard this before. I think we've spent so much time in the clinic trying to knock out the immune response using medications. We always try as a functional medicine clinic to try the natural element and trying to prescribe many of the common Metagenics products that have been made available to us. But there are these residual patients, just like Jennifer said, that you try everything and you don't really know how to resolve that critical component that just continues these patients in their quest to try to get better, but we just don't reach those goals. So this is just incredible that we actually have a new tool that can actually resolve the immune system's problem.
Corey.
The most intriguing thing to me about SPM Active is the amount of conditions we can use it in clinical practice. So whether it's your healthy patient who exercises frequently, who's a weekend warrior, who needs a little bit more accelerated tissue remodeling and cellular injury repair, it's exciting for them. And then also the patients that are dealing with conditions that are very hard to treat. And as clinicians, we see these patients day in and day out, and they have their conditions are refractory to conventional means. And so it's very exciting to be able to apply this product to them. The other major thing for me as an internist is I've got to make sure that every single day that I'm practicing evidence-based medicine, and time again, Metagenics has provided the type of products that are backed by evidence-based medicine, and this is one of them. So I'm super excited for it.
John, as a researcher, why are you so excited that through Metagenics you can bring this solution to the world that can help us better serve our patients?
You know, for the last 30 years, clinical science has been focused on only one aspect of an immune response, and that's been on the initiation phase of the immune response. The work that Charlie Serhan and his team have done is identified a secondary opportunity to take care of that, and that's the resolution phase of the immune response. So it's an exciting new area of science that gives us a better chance to more powerfully impact patient outcome by focusing on not only the initiation immune response, but also that secondary resolution of the immune response for even stronger and more compelling outcomes.
So Bridget, why are you so excited about being part of this clinical trial of SPM Active and bringing that to your patients?
Well, one of the population I'm really interested in looking at is going to be the aging population. I think especially like menopausal women who, as you know, boy, once that hormone turns off, you start noticing your joints hurt more body pain. So I'm really anxious to see if I can really touch that population, and I'm anxious to pull some of them into my research.
Corey.
Fab, I'm thrilled to partner with Metagenics in this enrollment. I have hand-selected some patients that I think are going to be great candidates. Some of these patients are dealing with age-related conditions that millions of Americans do, just general wear and tear of certain areas of their body that leads to discomfort that just doesn't get relief from general means. So I'm thrilled for these patients because it's going to be so applicable to not just them, but millions and millions. And I'm thrilled to be a part of a top-notch team here and collaborate with them and meet back with them to see how they're doing and what their clinical outcomes are.
John, what would you like to say to our volunteer providers as to your excitement in partnering with them and being able to be part of this clinical trial of SPM Active and being able to get the data to support the outcomes that we have been looking forward to?
Right. You know, in general, we're at the point in healthcare that we can bring about a truly transformational change in healthcare systems and in how we treat patients and improve their patient outcomes. And that can only be done through partnerships like we enjoy now, and the opportunity and the privilege that we have as a company to work with you all makes a difference, not only in the healthcare system, not only in the lives of our patients, but also in the quality of care that we're able to bring about into the healthcare system in a way that has not been possible before. So thanks very much for all the work and the insights that you share with us and the chance to be able to work so closely with you all.
So I hope you're just as excited as I am, because after listening to our esteemed panel of various disciplines, one of the things that I get the most excited about is that I feel their heart. I feel their sense of commitment towards their patients. You see, we all decided to become providers, just like you probably, because we want to help people. And what I'm excited about Metagenics and the research team of Metagenics is that they're leveraging the most innovative science to come up with new solutions. Solutions that haven't been brought to the forefront before, but solutions that are going to allow us to help our patients in a way that we've never been able to do before. So thank you all for being here, and thank you for listening, and be looking for SPM Active, because it's going to revolutionize the world of nutrition.